Hello friends, so this is the last 8 questions that I'm recording for you from the first mini test of the 40 questions. So due to some glitch in the live session, we could not complete there. So the remaining questions I am quickly discussing here for each one of you for last minute revision. So starting with the question number 32, we had seen this question number 31 about Hutchinson's triad. Coming to the question number 32, that is Brenner's tumor. Remember, Brenner is rhyming with bladder, and bladder has transitional epithelium. So remember, this is transitional tumor, epithelial tumor. This is epithelial tumor. Similarly, the other epithelial tumors are the clear cell, the serous, the mucinous, right? The various types of epitheliums that can be there. So even clear cell has been asked in previous INICET. It's a epithelial tumor. Dysgerminoma, remember dysgerminoma, germ. So it's a germ cell tumor. Dysgerminoma is a germ cell tumor. Granulosa cell tumor. Granulosa cell are the supporting cells in the ovary, so sex-cord stromal tumor. So granulosa, fibroma, thecoma will come here. Remember, everything which is related to pregnancy, fetus development, that is going to be germ cell tumor. So placenta, choriocarcinoma. Then you have all the 3 germ layers tumor, that is dermoid teratoma. Then you have yolk sac. Yolk sac tumor is also a germ cell tumor. Right? We have discussed all this classification in the short classes also. Going to next one, engaging diameter in the Bro presentation is, remember, this is BMW, Bro, so remember like BM, okay, that is BMW, BMV. So remember, it is mento-vertical, which is the longest engaging diameter in the fetus, okay, the longest engaging diameter. So this is mento-vertical, Bro is BMW, MV, mento-vertical, which is the longest diameter. Going to the next one, tumor marker in this tumor is, so what do you see here is this tumor, the ovarian tumor, it has this pseudo rosette appearance with the central pink material. This is not a yolk sac tumor. You are not seeing like the Bowman space like clear layer here. There is no central capillary here. So this is not a yolk sac tumor. This is a granulosa cell tumor, pseudo rosette appearance, called Exner bodies. I hope you remember Granny, granulosa, Granny, excited, calls her X. Call Exner over a cup of coffee, coffee bean nuclei, what it has, and the X gets the roses, so pseudo rosette appearance, okay. And anybody can inhibit your granny from calling the X? No, nobody can inhibit. So remember, it is inhibin, which is the tumor marker for granulosa cell. And remember, for yolk sac tumor, it is alpha fetoprotein. So whatever is the germ cell, including the yolk sac, it is alpha fetoprotein, except dysgerminoma. Remember, dysgerminoma, DPL, Delhi Premier League, it is PLAP and LDH, which is the tumor marker. Next one, according to CEAP classification, edema is, so remember the mnemonic here is TV Isha, right? That is a mnemonic for CEAP C classification, C1, 2, 3, 4, 5, 6. E stands for edema. Right, so C1 is telangiectasia, V is varicose veins, E is edema, and S is the skin changes. So edema, TV, Isha, remember this is C3. Next one, all of the following are ECG changes seen in hyperkalemia except which of the following? So remember, hyperkalemia, increased potassium. Potassium is responsible for the repolarization, that is the T wave. So increased potassium will have increased T wave, and whenever the T is more, the P goes down. The T goes down, the P goes up. So remember the opposite, that is the P will go down. Flat or absent P wave is what we would see, right? So there will be tall tentate T waves. Remember, U is UK, under kalemia, it is seen in hypokalemia. There will be loss of P wave, opposite to T wave, and there will be this sine wave pattern. Remember, sine, IN, it is seen in increased potassium, hyperkalemia, severe hyperkalemia. Going to next one, all of the following will increase murmur of aortic stenosis except. Now remember here, aortic stenosis is a left-sided murmur. Aortic valve is left-sided. Mitral valve is left-sided. So left-sided murmurs increase with expiration. Right-sided increase with inspiration. Carvalho's law. So it will increase with expiration. Squatting. Remember what effect the squatting have is it increases the venous return. As the venous return will increase to the heart, that means more blood will come to the heart, more blood will flow across that stenotic valve, so it will cause more murmur. So increased flow will have increased stenotic murmur. Amyl nitrite effect is decreased afterload, that is the peripheral resistance decreases. So what happens is, again it is trying to increase the flow across the across the aortic valve. So again, the stenotic murmur will increase. So Valsalva is something which does not increase the aortic stenosis murmur because it decreases the venous return. So the flow decreases, and that is why the murmur decreases. So remember, the answer here is going to be Valsalva. Okay, the Valsalva. Valsalva increases the murmur of HOCM and mitral valve prolapse. Okay, remember the mnemonic was VAST. That is Valsalva, amyl nitrate, ST is standing, increases the murmur of HOCM and mitral valve prolapse. Next one, the nodules shown in the image are which nodules? You see the nodules here at the periphery of this pupil. The iris defect pupil, uske periphery pe, these are the Koppes nodules. PP, remember pupil periphery is the Koppes nodules. The nodules on the surface of the iris, surface would be Basakas. Basaka SS on the surface of the iris and Koppes on the pupil periphery. Dahlen-Fuchs nodules are seen in sympathetic ophthalmitis, right? Retina fundus mein dikhte hain. And you have Lish nodules which are seen in NF1. Okay, Lish nodules which are seen in neurofibromatosis type 1. Coming to the next question here, this tympanogram would be seen in which condition? So this tympanogram that you see is a discontinuous curve, right? The two ends are not meeting. So we remember it with the mnemonic that discontinuous, D for D, is AD type. Okay, that is the AD type, and it is seen in discontinuous graph, is seen in discontinuous ossicles. Okay, so ossicular discontinuity will have a discontinuous graph as well. Otosclerosis, AS, S for shortened graph will be there. Serous otitis media, where there is fluid. Remember, the serous otitis media will give the base wala. Okay, that is the type B curve. Okay, that is going to be flat. Fluid will give flat curve, that is type B, fluid. And retracted will give type C. So this is discontinuous graph, discontinuous ossicles that can be seen in trauma. Okay, that can be seen in trauma. And going to next one, which nerve is injured in this patient? What are we seeing here is like the pointing index, Oshner's clasp, the index is pointing there. So pointing index, Oshner's clasp, remember the PP wale was seen with median nerve. What was the PP with the median nerve? Pen test, pointing index, ape thumb, Pope benediction. So, and remember for median nerve, MNOP alphabetically. N for Nevin sign, kilonevin sign, and Oshner's clasp. Right? So, this is going to be median nerve. Okay, remember pen test is done for which muscle action? You are going to tell me this in the comments that the pen test that we do is what muscle we are testing for in the pen test, right? So that was about the mini test 1 where we had 40 questions in 42 minutes. We have the next test that's going to be live tomorrow, and the discussion will be done day after tomorrow in app for the subscribers. Thank you so much. Remember, all these mnemonics that we have learned in this mini test discussion are extremely important. Please revise them well before your exam. And all the short topics, mnemonics that we have discussed, all of this was from short, right? So please make sure you revise all of that very, very well. Thank you. Goodbye. Take care. Keep studying, keep revising, keep Medsynapsing, and keep winning. Thank you.